As you guys know, I went to a conference out in Colorado this weekend on alternative therapies that we could be using in our clinics. I found this one really interesting. It's partial body weight treadmill training. And basically what this entails is we can hook up our patients on the treadmill with an overhead harness to unweight their body. We can do that up to 50% of their body weight max. But they actually recommend that we, with therapeutic purposes, we should be having them at about 30% and then decrease as we go to unweight them further as they improve with gait. And then use this about 2 times a week for about 30-minute sessions. Would it be beneficial, and then adjust the speed as we need to, to improve their cadence. But it was really neat. They talked about the history with them, and they used cats back in 1960, and they transected their spinal cords, and they found that they were producing these stepping patterns with the use of this treadmill therapy. And so this is completely similar to humans that they found out that they also have those central pattern generators. So I thought that was really interesting that we can compare this and actually use this for our patients. Do you guys have any questions before we start looking into possibly using this for our clinic?
I'm curious what kind of patient populations we can use this in.
Since we're in the neuro-based pediatric setting, we can use it with our patients that have CP, Down syndrome, spina bifida, or spinal cord injuries. And then they also are using this in hospital settings for patients with Parkinson's, arthritis, joint replacements, and also stroke patients.
What about some specific indications for the use of this?
They were talking about the best way to use this with our patients would be if they have this decreased stride length. So to promote better stride, increased stride, we can use those on patients that are having trouble with gait. Any of the patients that have balance and coordination deficits, or even some of the strength deficits to promote improved gait and getting back to functioning.
What other settings can we see this type of therapy being used?
Other than the hospital setting, like I said earlier, they're using them in the school settings, like developmental disability schools, as well as clinical settings such as ours.
Okay.
And they actually, I was looking into it the other day, once I got back, that School 84 in Buffalo General Hospital has treadmill therapy.
What healthcare providers can administer this therapy, and what kind of training do you need in order to do so?
They said that there's not really any special training required to start using the partial body weight treadmill training, but they recommend that if you want to start using this training, that you kind of seek someone with specialized training with this. If we want to start using it more frequently, so using it in most of our patients.
What are some benefits to this unweighted treadmill training?
I looked into it as well as at the conference. They were talking about the different research that's supporting this and what they found, and they were saying that it's basically helping with transfers and stair negotiation to promote further function in our patients, increasing their postural control, as well as their static and dynamic balance. We want to be further improving their ability to stand up without losing their balance, as well as if they're reaching out or going outside of their base of support. Also to decrease the fall risks. So those patients that are in the hospital setting, such as stroke patients or Parkinson's disease, those that are having trouble with falling frequently, this can kind of control that environment with that harness in the treadmill. As well as it's a task-specific practice and training, so it's pretty functional for kids.
Is there anything negative that we should know about it?
Patients that aren't used to getting up and walking like this, such as our patients, it's going to be a process. It's going to be difficult for them in the sense that they're going to get fatigued. 30 minutes for them trying to be weight bearing it's going to be a struggle. As well as our kiddos that are having trouble focusing, we all know how that goes. And then you might see a plateau, and then them wanting to cooperate as we implore using the treadmill. It's not always the most exciting thing to be on the treadmill, being hooked up in a harness. And then the harness, if they have any integumentary issues or cardiac issues, respiratory issues, or any history of seizures, we want to be very conscious of that and make sure we're controlling and being ready for that.
Last but not least, what about the cost?
I was looking into it already. I think this would be really useful for our clinic, but it ranges all over the place. The starting prices were anywhere from about $500 to $2,000.
Is it covered by insurance for patients?
I think most of our patients, their insurance should cover it.
Thank you. Thank
It's
you.
really informative.